Hi guys, welcome back to one more episode in Becoming a Great Pet Parent. Today we have Dr. Sagar with us, who is a practicing veterinary physician and surgeon from Pune for the past 22 years at AMS Pet Clinic, specialist in soft tissue and ortho surgeries. Welcome sir to the podcast, and over a period of quite a few days now and months now, we have been learning how to become a good pet parent. And this is one topic, that there's not that much info about it in the world right now. People are aware of it, but people don't have much details about it. So when we talk about sterilization, why is it important for pets?
So, thank you so much for inviting us. Okay, I will talk about sterilization. Sterilization is going to be a procedure. What we do is surgical procedure in pets. So in dogs, what we call is neutering or castration. And in female dogs, what we call spaying. Or the other way, it can be called ovarystrophy. So we remove the part of the reproductive organ, including the ovary and the uterus. So these surgeries, we normally do it just to prevent excess hormone disorders and health-related disorders with progress in the age.
Okay. Is this something that you would generally recommend, or is it breed specific, or is it what you could say age specific?
Normally we go with the surgical plan at the age of puberty, that is maybe 6 to 9 months of the age.
Okay.
In respect of sex, male or female.
Okay.
So then we normally do a clinical checkup thoroughly before. Like we like to see the weight, we like to see the breed specific, and we like to see the general appearance of the body like that.
Okay.
And then we plan the surgical things. Yes.
So there's a lot of, I don't know whether it is a myth or a fact, that the pet's behavior changes after sterilization. Is it true?
No, ideally not. We have not seen across any behavioral changes so far in pets in so many years. But definitely, if it is a hormonal driven, then they calm down. If it is hormonal driven, then after neutering, I've seen most of the aggressive dogs or the other aggressive pets, they definitely calm down.
Okay.
But certainly there are no changes in the traits and the personality, even if you after neutering rather.
Okay. And does sterilization have some specific health benefits?
Yeah, of course. Of course. Sterilization do have a specific health benefits. Like if you consider in male in why we do the neutering in male, because I would say in the dogs, in canines, because in canines, most of the male dogs, if you don't neuter, we have many cases of benign prostatic hyperplasia in certain age.
Sorry, I do not understand.
It is called BPH, benign prostatic hyperplasia. Then that is the age that we normally get the cases of unneutered dog between 5 years to 8 years.
Okay, and what happens if
in BPH they lose control over the urine, so they have a difficulty in passing urine or difficulty in passing stool. So they have a typical straining behavior while passing stool. So these things sometimes goes unnoticed from the clients, and when the disease is already existed, then they come to us. So and they mostly unneutered male. And the reason is the hormonal
unneutered males,
unneutered pets, basically. Unneutered male. I'm talking about the male, so it's going to be unneutered male. So and to prevent the testicular cancers, that's obviously it's the genuine reason in the male to neuter them.
Okay. So what about females, Dr. Sagar?
Yes, mostly female do suffer more compared to males. Because in females, the heat cycle is every 6 months, and even every heat cycle later, they have this so-called pseudo pregnancy. So these are the hormonal changes normally all female dogs go through it.
Okay.
So the maximum risk for the female dogs, if you don't neuter them, is going to be a mammary tumor. Usually they get the mammary tumor, or they're very prone to get the mammary tumor between 6 years to 9 years. And it can be sometimes cancerous, and it can mets in other body parts. So that's going to be a little difficult for the pet and the owners also later. And mostly it prevents all these hormonal related things. I mean, very simple UTI also can be hormonally driven. It can happen in females, and because of persistent UTI, they get stones in the bladder and other related things.
Correct. And because it's a surgery, are there any risks involved?
Sterilization, if I'm talking about, definitely there is no much risk. It's a day-to-day surgery, but there's always a risk in each and all surgeries in pets, because we need to monitor each and everything before surgery. That we do have a pre-op test, or we do a cardiac monitoring and certain tests regarding the heart and the other things need to be done. Okay. But yeah, there is no much risk in sterilization, as in if you have other surgeries, major surgeries like in ortho and the soft tissue tumors, they are mostly risk involving, but ideally not.
So is this a fact or a myth, Dr. Sagar, that sterilization will lead to weight gain?
Well, it is not fact. but certainly they do gain weight after sterilization at actual birth. There are certain reasons for it, because most of the time after sterilization, the calorie intake or calorie exercise comes down in the pets, and they tend to eat more. And
they tend to eat more.
Okay. And then eventually we have noticed that most of the pet owners, they try to feed them little more, because as in it's happiness for them, because pet is asking more food. So then unnoticeably pets do put on weight later on.
Okay.
And obviously, yeah, that's been seen, but more frequently.
So when you get your pet sterilized, okay, then is there a change in nutrition management that you should look at?
Yeah, after surgery, there's going to be different diet altogether. Because after surgery, obviously we shift the pet to the balanced food. We try to make sure that the food should not be into high protein or other stuff. And it makes a lot of difference if you concisely give the precise food after post-surgery, just to balance them, just to keep them healthy.
So there is this one thing that I had written down, because I really don't understand what it means. It's called something called RSS, relative supersaturation of urine. And why is it important for sterilized pets?
Well, after sterilization, we need to monitor RSS, relative supersaturation, because there are certain changes in the metabolism and urine concentration, leading to the urine infection and having them prone to get urolithosis. So we wisely have to monitor the urine sample for the RSS.
And as a pet parent, okay, what should I do? For example, giving more water, or is there something that I can do to avoid this situation?
No, certainly in urine test, you may find a certain amount of crystals or stones formation in the urine.
Okay.
That means either there's a change in the diet of the pet, or maybe the pets are having too much of protein or too much of other stuff. That things are causing the urine higher formation, urine saturation, and leading to the stone formation. So subsequently, these pets need a different formulation of the diet, which controls or which subsets the urine infection and maintains the urinary health in well-being.
So diet is the key thing. Anything else that we could do?
Mostly diet plays major role to control.
Diet plays a major role. Okay. And when we're talking about diet only, what kind of diet would you recommend for sterilized pets? Because earlier we spoke that you said that entire organ is being taken out. Yeah. So the amount of calories needed. So what kind of diet would you recommend for a sterilized pet?
Well, sterilized pet, because they tend to put on weight, so we have different formulations. There are many food products, or maybe different food products.
So once the pet is sterilized, is there a diet change that is needed or a nutrition change that is needed?
Yes, after sterilization, there is a special diet,
Okay.
such as Royal Canin has sterilized food. Okay. So advantage of that, just to maintain the weight gain, it has got a moderate calories, and just to balance the proper vitamins, proper calciums in the body. And third, just to space out certain proteins, just to build up their energies, or just to build up their muscles. It has contained the proteins.
Because you said that they might appear lazy after sterilization.
Certainly. That's how this food is modified with certain things to control the weight gain, to add on protein for the building of muscles.
Correct.
And certainly they should not miss out all these vitamins, necessary vitamins and certain minerals.
Because you mentioned earlier where a certain organ is now being removed. So the number of calories in the requirement actually would be lesser in the body. So that's what this kind of diet helps.
Obviously, see, in sterilization, what we do, we remove the organs as such. So most of the calories get directly deposited in the body. So that's how these food formulations are differently made. It has got a moderate calories that they should not be gaining too much of weight.
Correct. Moving on to the next question. Can a female pet have 1 litter before being spayed?
Well, there is no scientific reason for the same. Because most of the time, it is not that the female should deliver at least once and, then we can spay them. There is no scientific reason behind it.
There's no scientific reason.
No.
Because generally, when I've seen this conversation happen between pet parents, okay,
yes,
they would say, Nani, at least once she should deliver and only then you should do this. So there is no studies supporting. So this is actually a myth.
Actually not. But yeah, but if you want to really breed, you need to really consult your veterinary doctor and be a responsible pet parents to make sure that everything goes smoothly. But as in, there is no scientific reason. There is no scientific once at least.
Yes.
That, no.
So after such sterilization, can I still breed my pet? Is it possible?
Sterilization is irreversible. Because in sterilization, we normally remove the organs. We remove the reproductive organs. In females, we remove the ovaries and the entire uterus. So they don't get heat cycle post surgery.
Okay, there are no
So there is no
heat
chance
cycles.
of breeding them or getting into the hormonal driven.
Okay, and do we see any significant behavioral changes? We spoke about this a little bit earlier, but right now, because you spoke about heat cycle, right? And I had a female dog, okay, a golden retriever. She was called Phoebe, and after her heat cycle, during the heat cycle and after a heat cycle, I could see specific behavior changes. She should quieten down a bit and everything. But once sterilized,
Okay.
would we also see such behaviors or no? Once, because the organ is only removed.
So certainly there is no change in the personality. We have seen most of the dogs remain same post sterilization.
Okay.
Because they tend to be the same as a personality or traits, everything. But yeah, there are certain changes that if you don't handle at the right time, as in the weight gain and other things, then we do see some changes in them.
Okay. Okay. And any tips that you would want to say, once you've got your pet sterilized? One in nutrition we spoke about, right? Yes. And anything else that you would want to add?
So see, segmentally, the diet is different at the different ages of the pets. Okay. So in dogs and cats, I would say in dogs I talk about the puppies, the starters, then the puppies, then the junior and the adults. So the sterilization age is between 6 months to 8 months at the puberty time. But most of the time we do it between 12 months to 16 months because then they fully matured. Okay. And they don't have any anatomical deformities. Like most of the time, if you neuter them very early, they do have a bone weakening, or they do get early arthritis in the later age. So just to prevent that, the right age is in our Indian dogs maybe between 13 months to 18 months.
So once sterilized, will my male dog stop marking or humping?
Well, actually, yeah. If it is hormonally driven, if it is only because of the testosterone, he will definitely stop that. He will stop that. But if it is instinctive, because most of the pets post neutering also they are instinctive, but they still continue the same.
They still continue.
Yeah, they will still continue the same acts what they do before. It is nothing to do with the hormonal changes. But these pets will need proper training and the proper guidance from the owner also.
So once sterilized, how long does a pet take to recover?
Most of the pets, they do recover within 7 to 10 days post surgery. So there are certainly certain post-op care that need to be followed to take care that they should not lick the surgical wound excessively, or there should not be too much of activity, just to make sure that there should not be any disturbance in the suture healing. So, but ideally it takes 8 to 10 days for the complete recovery of post-sterilization.
So thank you so much for being with us. And we generally ask all our guests for these golden rules. Now, when it comes to sterilization, before, after, during, what are these 3-4 things that we could remember as pet parents that our pets' life and that time, yes, is comfortable for them?
Well, I'm going to tell about certain things about sterilization. So I will start with the age of the sterilization because your pets should be minimum 12 to 16 months of age to have the neutering surgery. Well, second thing, post-surgery, we need to deal with certain consequences regarding the weight and regarding the lethargy. So we can definitely look into the diet properly and along with the exercise also. So with the proper take care of the diet and the exercise, will definitely keep them healthy. And sterilization does help in certainly to reduce the aggressive behavior because most of the time, because of some pets are hormonally driven and post-surgery, it really helps them to have a normal and healthy life. Thank you.
So thank you so much for watching the entire podcast. And I'm sure that like me, this will help you also to become a great pet parent. Thank you so much. See you guys. Bye-bye.